Good afternoon, and thank you for joining us for OCTALK, the show dedicated to helping home health and hospice providers run compliant and successful agencies. OCTALK aims to bring you closer to reliable experts in home health and hospice and to share the latest news and information from the industry and from the Association of Home Care and Coding Compliance. I'm Jan Milliman, Director for OC, and I'm happy to be hosting today's program. This afternoon, we're talking about the 2025 Home Health PPS proposed rule. And now I'd like to introduce our industry guest for this episode. We have with us today Sharon Harder, president of C3 Advisors, LLC. At C3 Advisors, Harder oversees all home health and hospice client projects, the majority of which are focused on compliance issues, including scheduled Medicare, Medicaid compliance audits, acquisition due diligence, preparation of responses to investigations, and labor compensation issues. Thanks for joining us today, Sharon.
Glad to be here, Jan.
And today we'll be talking about the 2025 Home Health PPS proposed rule. And I'd like to kick things off with an audience poll. So let me get that launched for you all. Our question for you today: which potential outcome of the proposed home health PPS payment cuts most concerns you? And the proposals we have listed out for you: a decrease in the number of home health agencies, reductions in territory covered, reductions in disciplines of care provided, struggle to recruit and retain top clinicians, or something else. And if there's something else that concerns you about potential cuts, please go ahead and choose that option, and then you can share your what that something else is in the chat pane or in the question box, and we can discuss that a little bit later on in the call. I see folks are still voting, so I'll give it another second or two before I close out that poll. All right, our numbers are climbing. Okay, I'm gonna close this down so folks get those last minute votes in, and then we'll discuss the results a little bit later on. Thanks so much for participating, everyone. All right, so on to our topic for today. Listeners, if you have any questions for our panelists today, please go ahead and ask those in the chat pane, and we'll try to get to as many of them as we can. And our topic for today is the Home Health PPS proposed rule. And Sharon, I'm going to turn that over to you. I will try to keep up with you advancing the slides, but just let me know if I need to move things along. Thanks.
All right. Thanks, Jan. So if you haven't gotten the proposed rule yet, you should, and you should read it. We've got just a few minutes today, so this is not going to be a deep dive into what's there, but we'll sort of cruise about 30,000 feet above things to just give you an idea of what's there. So there are five big things that are in the rule. The first of which is the decrease in home health spending of 1.7%. For about a $280 million overall reduction in home health spending. Pardon me. So there's no big surprise there. Basically, if you get into the rule and you look at the base rate change, what you'll see is, typical CMS, they've taken 5 different arithmetic steps to figure out a $30 decrease in the standard rate for a payment period. So payment periods are going to go from a base rate of $2,038.13 this year to $2,008.12 next year through the application of the permanent behavioral adjustment, as well as the case mix recalibration, and then the wage index calculations, and then the payment update. So we've got recalibrations of all the case mix weights and the wage indexes. That too is expected because about 5 years ago, CMS said that they were going to, or 3 years ago. They said they were going to update these every year. So we'll look at those just in kind of a global way with a future slide. We've got new measures for 2027 home health quality reporting. We've got some expanded value-based purchasing ideas. It's basically a request for information. And then we've got updates, and I think this last one is probably the biggest in terms of strategy and planning, and that's the updates to the conditions of participation. So Jan, move the slide and we'll just start slogging through this. So here you can see that we've got the clinical groupings. There are an even dozen of them. And what's kind of interesting this year is that the case mix weights for all but two are going down. So we've got wounds going up just a little bit, endo going up just a little bit, everything else goes down. With the big ones being concentrated at the bottom with MMTA cardiac, MMTA other, MS rehab, which is going down on average 2%, as well as neuro, which was one of the higher paying case mix groups, now going down by an average of 2.6. So if you're doing a lot of MS rehab or a lot of neuro work with post-stroke patients or Parkinson's or other patients, you're going to want to be looking at some of those, because as you know, the primary diagnosis is going to drive the clinical group, which is in turn going to drive your reimbursement. Okay, Jan, next slide. So we've got comorbidity adjustments too. So basically, we've got a few that have been removed and a few that have been added. So 3 and 3. So circulatory 7, neuro 4, respiratory 10 have been removed, and then endocrine 3, neoplasms 20, and gastrointestinal 2 have been added. So what's happening here is that the number of subgroups in the high comorbidity have gone down from about 102 to 97. So this is something too that particularly you coders will want to be looking at, so that we have clear understanding of what the comorbidity adjustments are going to be, because that is entirely focused on coding of secondary and subsequent diagnosis. Okay, Jan, next slide. So here's just this is the distribution of this, and you can see. Whoops, what did I just do? I lost my screen. You can see how the changes have been made. I think the most interesting one is between calendar year 2022 and subsequently, particularly for none. So you can see how that has been changing, and then the others, that's going down. The others are basically going up just a little bit. With the high category is not changing as much as the other two, but the category for no comorbidity adjustment is changing a lot. Okay, Jan. So we've got OASIS updates. This is something too that you all are going to want to be paying attention to. So we've got 3 that are focused on quality reporting in 2027. So as of next January, January a year out. Living situation. So what we're going to be talking about is housing instability, homelessness, poor quality housing, and the question is going to be, what's your living situation today? We've got food insecurity, which is along the lines of within the last 12 months, are you worried that your food would run out before you got money to buy more? Or within the last 12 months, the food you bought just didn't last and you didn't have money to get more. So these are questions that are aimed at SDOH, and we're going to see more and more of this as time goes on. Of course, the third one is utilities. In the past 12 months, has the electric, gas, oil, or water company threatened to shut off services in your home? If you've had anybody who has gone to the hospital lately or into even a subacute facility, you'll know that these questions are being asked there now. So as is the case for home health, we're a few years behind everybody else, and we're going to catch up in 2027. So Jan, advance the slide. The other things that we've got are updates to transportation, which is A1250. In the last 12 months, has a lack of reliable transportation kept you from medical appointments, meetings, work, or from getting things done or getting things needed for daily living? So those are really the four questions. I think I said three, but there are four. The other thing here that we need to realize, and this is effective next year, is that we are going to have OASIS submissions with the start of care for all payers. So it's voluntary as of January. It's mandatory as of July 1st. So they're doing this a little bit like they did with listing telehealth services on claims, which was voluntary in January and mandatory in July. Same song, second verse here for submissions with the start of care for OASIS. All payers. That's not just Medicare and Medicaid. That's everybody that you're dealing with. Okay. So, request for information. This is an invitation for public comments. Once again, there are a handful of these. So the composite of vaccination, depression, pain management, substance abuse disorders, which is the initiation and engagement of substance abuse disorder treatment measure, and then rehabilitative therapists conducting the initial and comprehensive assessment. So these are things that you can and should think about and include in your response to the proposed rule if you're going to make one. And of course, we recommend that everyone do, because this is not the time to just sit on the sidelines and let things go on without comment. And remember that CMS does, not always, but occasionally they take our advice and they incorporate that. And of course, when they do, they're always good to tell us about it. All right, Jen, next one. So I think this is sort of the biggest of the bunch in my estimation, and these are going to be changes to the condition of participation at 484-105. So 42 CFR 484-105, and in essence, there are three things here, and all three of them have meaning for you, both in terms of strategy as well as the manner in which you organize your internal operations and processes, particularly related to the evaluation of new or newly referred patients. So the changes are going to require that agencies develop, implement, and maintain an acceptance to service policy. So think of this as an admission policy that is applied consistently to each prospective payment referred for home health patient. So in essence, what you're going to do, this is going to be a survey issue, assuming this goes through the way that it's proposed. So surveyors are going to come in and they're going to look at your patients who are taken for admission, and they are going to look at your NTUCs, as we affectionately call them, those who are not taken under care, and they're going to compare them, and they're going to compare the acceptances, the admissions, or the non-admissions to your policy on the subject. So this is going to require a little bit of thought. The proposal is that the policy be reviewed annually and address at a minimum the following criteria related to capacity to provide patient care: the anticipated needs of the referred prospective client, the home health agency's caseload and case mix, staffing levels, and the skills and competencies of the home health agency staff. So what this means is you're going to have to continually update and look at all of the patients that you have under service at any given time in terms of their case mix, the services that you are providing, your staffing levels, and your ability to bring the appropriate staff members with the appropriate skills to the patient in order to provide services. And you know what they're not saying here, but I think it is kind of a no-brainer. They are expecting us to make this information publicly available, which probably means that at some point in time, this is data that hospitals and other referral sources are going to be asking you for. So it's kind of a two-pronged or three-pronged thing, really. We're going to have to develop the policy. It's going to have to be looked at by the board. So this is yet another thing that the board every year is going to have to sign off on. And then you're going to have to maintain the data to show that you're actually looking at this and that you are applying the policy appropriately. So this is something that I think agencies and staff leadership should be thinking about in the context of your responses. So the second thing is that agencies would be required to include information regarding caseload and case mix. So the volume and complexity of patients currently receiving care, their anticipated needs, and referred prospective patients. So we're looking not only at who we've got, but who we are expecting and how that is going to challenge, if it is, our ability to appropriately staff the cases that we've got. And then third, as I alluded to before, making public accurate information regarding the services offered and any limitations that you might experience to the type of specialty services or duration or frequency that we have. So for agencies, just to kind of put this all into context, for agencies that really focus a lot on certain types of patients, like MS rehab, where we have a relationship with a surgeon or a surgical group where we are taking a lot of their patients for home health rehab. We're going to have to look at the availability of our therapy services as well as the skills of the therapists that we have. So OT, PT, and then when we get to neuro, we start to look at the availability of speech therapists, SLPs as well. And so this is going to take a little bit of analysis, a little bit of preparation of information for third-party consumption, and it's going to require some internal machinations in terms of adhering to the policy. So I think it's something that you really need to think about and you need to comment on if you can. So Jan, I think that's the last slide, is it not?
Yes, that's the last slide. And
Okay.
we did have one question come in, which I think is in reference to the proposed changes to the conditions of participation. Would these
Okay.
go into effect in January, or is this something that would be rolled out later on?
Well, in theory, so what happens with this is they're going to, with the final rule, they're going to give us the language changes to the Code of Federal Regulations. And it will probably be effective as of January, and they will start measuring it sometime after that when they finally publish the Code of Federal Regulations. But we should assume that it's basically next year.
Okay, so definitely something to be watching for and commenting on. And
Right.
Thanks so much, Sharon. This was a really helpful rundown of what's going on. We want to encourage everybody to go and read the rule for further information, and we've included a link in the handouts that will take you to where the rule is published in the Federal Register. And then there's also a link on that page to where you can submit your comments. And those comments are due August 26th. So be sure to study up and start writing those letters about the aspects of this that you want to have a voice in. Thanks again, Sharon.
Sure.
Let's take a look at our poll results. We asked you which potential outcome of the proposed home health PPS payment cuts most concern you, and it looks like we had struggled to recruit and retain top clinicians as the biggest concern, and reductions in disciplines of care provided is pretty close behind that. And then we had folks voting for the other two, decrease in number of home health agencies and reductions in territory covered, and something else, but I don't think that person told us what that something else is. But obviously there's a lot to consider when we look at the cuts that are proposed. Sharon, any thoughts about those poll results?
Well, yeah, I think our top two are interesting. So the struggle to recruit and retain clinicians clearly has been on everyone's mind for years now. And I think that it's going to deepen with the addition of the change to the COPs at 484-105, because now we're really going to have to think about it. We're going to, before we take patients, and we're going to have to publicize our ability to staff, which basically means that we want clinicians who have discrete competencies to handle the types of patients that we're going to be most focused on. So I can see that is a really big issue, and it ties right into the COP change. The other thing is the reductions in disciplines of care provided. I know that there are a lot of home health agencies that are looking at these rate cuts. They know that they're not going to be compensated anymore, and we haven't been compensated since 2020 for the volume of therapy visits that we're doing. And they are looking at some of these MMTA clinical categories where therapy is involved, and they are really working on discharging those patients well within the first certification period and moving them, if they need therapy, to outpatient therapy. And the home health agencies, several actually that I've been working with, are undertaking that as an addition, outpatient therapy as an addition to their array of services. So they are continuing to take care of the patient and simply moving it to another service under their umbrella. So it's a strategic decision that needs to be considered, but it generally has more financial remuneration for the agencies who are thinking about it strategically. So I'm not surprised that 79% of our folks are looking at those two things, because that squares very well with everything I know about what's going on.
That makes sense. Thanks, Sharon. All right. And now it's time for What's New with AHC, where we share updates from the Association of Home Care Coding and Compliance. And we would like to remind you that there's still time to register for Decisions Health's upcoming Home Health Quality Outcomes and Documentation Conference. This conference is geared toward home health quality managers and clinical supervisors, and will focus on how to positively impact your home health agency's quality outcomes and ensure documentation compliance and proper payments. And the conference runs from September 16th to 18th. In Charlotte, North Carolina. And we have many AHC committee members speaking at the conference, so I'm sure there's going to be some great sessions. We hope you will attend, and remember that OCC members can save $100 off the registration fees, and there is a link in the handouts that you can follow to register. We hope you enjoyed this episode of OCC Talk. Thanks again, Sharon, for all the great information. And thanks to all of you for tuning in. We hope you'll join us again for our next call on August 19th, when OCC board member Kelly Kavanaugh will be discussing the OASIS GG items and giving a little preview for some of what she'll be speaking in greater depth about at that conference. In the meantime, if you'd like to re-listen to this episode or to a previous one on the go, you can find OCC Talk on your favorite podcast app. And if you have any suggestions for future guests, topics, or ideas about the format of the show, please send me an email at jan.milliman@decisionhealth.com. Thanks so much for listening, and we'll see you next month. Thanks again, Sharon. Take care.
You're welcome. Bye.
Bye.